Precision Surgical Group, and today I wanted to talk about getting or what's going to happen when you're about to have surgery. For people who's watching this video who's never had surgery before, it may be scary. Well, I'm sure it is scary the very first time you experience the whole thing. And so I wanted to explain the process of what is about to happen so that when comes surgery time, your mind is much more at ease. Now my little disclaimer, as always, is some surgeons or physicians may not completely agree with what I'm saying, and they may have a different point of view of everything that I said, which is great, which is okay. But this is just my opinion on the matter. Okay, so you met your surgeon, or you met me, or you met one of my partners, and it's time for you to have surgery. So basically, what happens is you arrive to the hospital, and once you get to the hospital, go to the information desk and ask them where you go to register for surgery, and they will direct you to the floor or to the area where you have to register. So you go to the registration booth. There will be somebody there to take your name, and you have to provide your insurance card, your identification, and then they'll take you to the back. Once they take you to the back or the holding area, that's where you change into a gown, and a nurse or some other healthcare professional will ask you a bunch of questions that I probably asked you, and a million other people probably ask you throughout the day. So be patient, and there's going to be a lot of forms for you to fill out. Once that part is done, you will change into a gown. Your stuff will go into a secure area, usually a locker, and you change into a gown. Once you change into your gown, either the nurse or maybe the anesthesiologist will insert an IV into your hand if your case is going to be done with anesthesia. The purpose of this IV is to administer the medications, and so if you're scared of needles, that may make you a little bit anxious, but it's unfortunately part of the process. Now, after you get your IV, the anesthesiologist is going to talk to you about the anesthesia for the surgery. Now, depending upon the type of anesthesia, it could be either sedation, where they give you kind of like a half anesthesia, where you're just kind of sleepy, you don't remember anything. Sometimes it's called twilight. We use that for colonoscopies or similar procedures, where you're not fully asleep and you don't require an intubation or a tube going down your throat into your lungs, where a machine will breathe for you temporarily. That's called general anesthesia, where you're completely out. The purpose for that is because you need muscle relaxation, or the surgery's a lot more involved. It'll ensure a safer surgery and a much more comfortable surgery. So the anesthesiologist is going to come talk to you. The anesthesiologist is going to come talk to you about that. Now, once you're okay with that, you see me or one of my partners or your surgeon, and they check in with you to see if you have any final questions that you want to ask before surgery. Now, once that's done, there's a consent form where it's the permission slip for surgery. And this consent form is that you are giving permission for the surgeon to perform the surgery that was agreed upon either in the clinic or in the emergency room or wherever. And that's mandatory for you to sign if you do agree to proceed with surgery. Following that, once everything is all set, the anesthesiologist is going to likely give you a medicine, some sort of medicine through your IV, and that's when you start getting really relaxed. And that's where you probably start forgetting things. And then we roll you at that point into the operating room. And the operating room, if you've never been in one, can be a scary place. It's usually quite large, very bright, a lot of equipment everywhere, which is necessary. And you have to be transferred from the cart that you're wheeled on to the actual operating bed, which is usually very narrow. And then once you're situated on this operating room table, it moves around, it's very cold, it's very hard, not very comfortable at all. There's a strap that's placed on your waist or your legs if it's going to be an abdominal procedure. It may be somewhere else on your chest if it's lower body. just to make sure that during the surgery you stay in place when you're supposed to go. Your arms will probably be fixed in place as well, also for your safety. This is all for your safety. We're not trying to torture you. And then you're going to get these what we call compression boots if it's not a leg surgery, where it pumps air into your legs to prevent blood clots to happen during the surgery. Because during the surgery, your body automatically goes into what we call a hypercoagulable state, or your blood clots really fast whenever there's a surgery happening, and we don't want your blood to clot and cause what we call a DVT, or deep vein thrombosis, in your leg, which can cause a pulmonary embolism, which can be potentially fatal. And by putting these boots on during the surgery, that can help prevent that. And so you'll get that during the surgery if it's not a leg procedure, obviously. Now, once you're in place, the anesthesiologist will give you another type of medication, which will completely put you out, and that's where you are just knocked out. You don't remember anything, and pretty much at that point, I should say, if it's general anesthesia, you're going to be totally knocked out. The anesthesiologist will pass a tube through your mouth into your lungs, and then connect you with tubing to the ventilator machine. And then once that's done, your surgery can proceed. And from this point on, that's where a lot of the techniques vary, and so I can't talk more about that because I don't know what surgery you're going to have. But that's the basic start of what's going to happen to you. So now that you know, hopefully you'll decrease a lot of anxiety, and your overall experience will be a lot better. So that being said, good luck on your upcoming surgery. If you have any questions, leave it in the comments below, and I'll try to answer it. Or if there's another topic you want to talk about, leave it in the comments below, so I can maybe make another video for you guys if you want. And like the video, that's what everybody says. And good luck.